Joel would be. I would like to introduce myself. My name is Sana Ajmal, and I am IDF Young Leaders alumnus. I live with type 1 diabetes, and I'm from Pakistan. Joel, would you like to introduce yourself?
Thank you, Sana. My name is João Navais. I'm one of the IDF vice presidents. I'm coming from Portugal, and I do have diabetes as well for the last 40 years or so. So I would like also to welcome everyone to this webinar to such important and relevant matter, diabetes in school and the KiDS project. It's for me a great pleasure to host this webinar with Sana, one of my friends. You will find this webinar interesting and useful. Just a reminder that webinar will be divided into two different parts. First, a discussion panel where high-level speakers will share existing mechanisms to promote an healthy school environment, and then a roundtable where participants will discuss the importance and challenges of bringing diabetes education to schools and the potential of KiDS to do it. We would like also to invite all of you to put questions in the chat box. It will be at the end of each segment, there will be a Q&A period. So please put all our questions on the chat box or Q&A box. We will try to answer all the questions at the end of each section. And then before starting, we would like to share with you a message from the IDF President, Professor Andrew Bolton, that could not be with us today due to other commitments.
Hello, Andrew Bolton, President of IDF, and thank you to João and Sana for their introduction, and welcome you all to this very important IDF KiDS webinar this afternoon. As you know, diabetes strikes all ages, from children to the elderly. Nobody is immune, and it can, of course, be a threat to health, prosperity, and quality of life. The latest figures from our atlas, just published, the IDF atlas, giving the statistics for diabetes across the world, suggests that more than 1.2 million children and adolescents have type 1 diabetes. And increasingly, we're seeing type 2 diabetes in children and adolescents due to altered lifestyles. We at the IDF believe it is extremely important from an early age to prevent diabetes-related stigma and promote healthy lifestyles to tackle the preventable risk factors for type 2 diabetes. With that in mind, we created the KiDS program some 8 years ago to promote diabetes education, healthy lifestyles in the school environment. Since its creation, we've reached out to 250,000 school children, students, and 20,000 teachers across more than 10 countries in the world. And we hope to go on expanding the program across the world to bring in more pupils, students, and teachers to help them to understand better living with diabetes. Lastly, I would like to thank our sponsor, Sanofi, for their very generous support, without which we would find it very difficult to continue. So with that, I wish you a most enjoyable webinar. I hope you learn more, and I hope we attract more people to the KiDS program, and I'll hand back to João and Sana. Thank you.
Thank you, Andrew. In fact, we would like to ask to thank Sanofi support, which has made possible KiDS through educational grants. Thank you, Andrew, for your message. It's now our great pleasure to have with us an excellent group of speakers to this discussion panel. We would like to thank you all for your time and contributions. Each one of the speakers will have a short intervention about each minute each, and at the end of the session, as I said, it will be a Q&A period. Please don't forget to put your questions on the chat box. So it's my pleasure to introduce all speakers to this panel. Mr. Leo Neverdien from Power Advisor from the Netherlands, Dr. Joanna Lai, UNICEF Health Specialist coming from the USA, Ms. Fatima Al-Zaroun from the Ministry of Health and Prevention of the United Arab Emirates, and Professor Karine de Beaufort, President of ISPAD. So I would like all speakers to keep the time on the 8 minutes period. And Mr. Leo, please, the floor is yours for your intervention.
Good morning, good afternoon, and good evening, everyone. Thank you very much for this opportunity. It's a pleasure to be with you from the Pan American Health Organization, which is the regional office of the World Health Organization. So I'm going to speak a little bit about school environment and healthy food, nutrition, physical activity in schools, which is essential in the prevention of diabetes. Next one, please. So a major problem we have worldwide is the increasing rates of obesity. And we can see that between 75 and now there has been a tenfold increase in obesity in children and adolescent aged 5 to 19 years. And we see that this increase has been particularly fast in the low and middle income countries, as you can see in this graph. Next one. At the same time, also physical inactivity has increased worldwide. Globally, 4 in 5 adolescents do not get enough physical activity. The WHO recommendation is at least 60 minutes of moderate to vigorous intensity physical activity in schools, and 80% is not meeting it, particularly girls. So physical activity is really important for the development, not only the physical and cardiovascular development, also the cognitive development. It has been seen that children who are physically active have better results in schools, and they also are less likely to have risky behavior. So this is an important moment in the life and development of children. Next one. Schools are a very important platform to improve the health and nutrition of children. Children pass on average 10 hours per day in schools during 10 years, most likely. So it follows a life course approach, and we can reach also the families and communities. Many schools have a platform of school feeding programs which we can use to promote healthier behavior and healthy lifestyles, and it allows us to have interventions during the whole school period and to develop the knowledge, attitudes and life skills which are needed at a critical age. Next one. So also the Commission, the WHO Commission on Ending Childhood Obesity has included the schools as a very important component to improve healthier lifestyles and develop healthy habits. And WHO also has a document which we call the School Policy Framework, which is based on the Health Promoting Schools initiative. And it recommends actions throughout the school curriculum by development of healthy lifestyles and also of skills. The food service environment, which should be conducive to healthy eating. Also the physical activity environment is important, which includes options for physical activity, but also the whole safety aspects and availability of safe water and the availability of healthy foods. Then it's also important to improve the health of the staff working in schools. School health services are important for screening, for the monitoring of overweight and obesity or any other health condition, also for referral and counseling. And then it's very important to involve as well the family and community. Next one. if we have a better look at the food service environment, it is important that all foods available in schools are regulated. Many schools are selling junk food or foods which are high in fat, sugar, and salt. And that's why we have in the Pan American Health Organization, but also in other WHO regions, a nutrient profile model, which defines which foods are not allowed to be sold or provided in schools. And those foods or beverages can also not be marketed. There can be no publicity or not any promotion or sponsoring of school events by companies that sell those foods and drinks. Next one. A few words about the Global Diabetes Compact, which is an initiative launched recently by the World Health Organization. And it's a package that includes all major tools and documents on diabetes management and prevention. It has several components. In the Pan American Health Organization, we are working on prevention and awareness through our regional plan on obesity prevention in adolescents and children's. It includes information, education, and communication, and as well the mobilization of community. Then monitoring is very important through population-based surveys for risk factors of non-communicable diseases, the inclusion of diabetes indicators in health information systems, as well as the monitoring and reporting. And then it also includes tools to improve diagnosis and treatment, an update of protocols and guidelines, building capacity of the healthcare providers, especially at the primary healthcare level, and to implement as well the quality improvement strategies and increase access to medicines and technologies. And finally, the self-management support is important. So as I said, it's really important to use schools as an opportunity to improve and to develop healthy habits from an early moment, and this will have benefits for the rest of the lives of the children. Next one. So this is the last one, and I would like to thank you for your attention.
Many thanks, Leo, for your contribution. Now it's my pleasure to give the floor to Dr. Joanna Lay. Dr. Joanna, please, the floor is yours.
Thank you so much. It's really great to be part of this discussion today. For children in schooling age, particularly in adolescence, we know that it's supposed to be physiologically time of peak health and peak strength. But as a whole, if we look at the global burden of disease data among this age group, there are some concerning trends that we're seeing today. If you don't mind going to the next slide. That some of these also mentioned previously as well, but the 30% of adolescents use alcohol and 19% tobacco products. Important to note that 11% are actually heavy episodic drinkers. The rate of obesity, as Naveen has also pointed out as an issue, is 5 times higher than it was a decade ago among 10 to 19-year-olds today, with noting that 81% also don't get enough physical activity today, and that 13% of 10 to 19-year-olds experience mental health conditions globally. And we know that many of these NCD risk factors are rooted in some of the same social determinants and have overlapping health outcomes as well. And on the next slide, we can see that from data from the 2019 Global Health Estimates, it shows that NCDs, particularly mental health conditions and also nutritional conditions, are leading causes of morbidity among this age group globally. For those of you who might wish to see this disaggregated causes of death and disease burden, I can definitely share dashboard tool where you can see those profiles. But as on the next slide, we see that considering 2/3 of premature adult deaths are associated with behaviors developed in young people, there is more we must do to ensure that healthy transition to adulthood. We know that habits and risk-taking behaviors leading to NCDs often do begin in adolescence, but we are also seeing from developmental and neuroscience that adolescence is really a critical window of opportunity for establishing those healthy behavior patterns that can increase trajectories for positive growth and also lifelong health. So it's really also important for us to take advantage of this and to understand that for many children and adolescents to make healthier choices, they actually have to overcome a number of negative influences as well to make those healthier lifestyle choices. And we've heard from a lot of young people that they've always been telling us that the conditions around them, whether socioeconomically, commercially, or environmentally, those are not conditions that they've created for themselves, they feel, but those are things that they've inherited from generations prior. And in fact, for them to make those healthier lifestyle changes, don't smoke, don't drink, be more physically active, have a healthier diet, reduce your carbon footprint, they have to unlearn a lot of things and undo a lot of behaviors, rebuild norms, new conditions, healthier environments. But luckily for us, adolescents are kind of in that phase of life, in a phase of development where they do that. They break rules, create new rules for themselves. And while we normally see that as a negative thing, it doesn't have to be. Positive risk-taking, positive peer influence, learning and skills building, these are all important things. I think the school environment is particularly well placed to foster. And economically, there's a lot we stand to gain from investment in prevention and promotion of NCDs for this age group. I'm happy to share the link later also, but RTI published an investment case recently, many of you may have already seen, that estimates the benefits of addressing 3 NCD risk factors in particular: tobacco use, heavy episodic drinking, and obesity, through school-based interventions, as well as increase in excise tax and advertising bans. And the estimate is that it could avert 21 million deaths over 50 years, and that would mean about a gain of $30 billion in cumulative economic benefits. And that's roughly for every dollar invested in NCD prevention, you would return $5. So that's a 4 times return on investment. It's quite a compelling case. And likewise, there's a lot we stand to lose if we don't respond, with NCDs estimating to cost the global economy $43 trillion US dollars over the 2 next decades. And in the next slide, it just goes to show also that if we are to achieve SDG 3, good health and well-being, and also fulfill the commitments we have in the Almaty and Astana declarations for health for all, it means that primary healthcare and public healthcare systems really need to focus on equitably meeting that diverse needs of children and young people globally, because children, school-age children particularly, are making up such a substantial proportion of the population. In 10 to 19-year-olds alone, that's 16% of the global population, with 90% living in low and middle income countries. And you can see, for example, in sub-Saharan Africa, that's 53% of the population is young. And why schools? We've also heard a little bit about that, but with 90% of children in the next slide, with 90% of primary school and 80% of children in lower secondary school pre-COVID, school is a really effective place, one of the most effective places we have to simultaneously improve both educational and learning outcomes as well as health outcomes. And I think school health programs are also important areas and a means for advocating for health equity and also equity in learning outcomes. In the next slide, I just want to quickly go over that. So I was reading the chat box, that in 1995, UNICEF, WHO, and UNESCO first launched a global school health initiative to mobilize, strengthen health promotion and educational activities, which would improve health of students, also school personnel, families, and community members. And just this year, WHO and UNESCO have relaunched this new global standards for health promoting schools that identify 8 elements of health promoting schools and systems. You can see, for time's sake, I may not read all of them, but you can see that it goes from policy and procedure levels, looking at the different spheres of influence around the school environment and the child, down to specific skills building and learning. And based on UNICEF's annual country reporting in 2020, in the next slide, we have seen that that 90 countries reported having some kind of school health program which reached adolescents in 2 or more intervention areas, with UNICEF supporting 42 of those. So you can see there was an increase. I think had it not been COVID, this might have seen an even bigger growth. And if we look on the next slide, we can see that some of the different interventions that were being delivered, a lot in the area of nutrition, a lot in the area of hygiene and sanitation, but also increasingly in other areas, as you can see from here. There is a range of kind of integrated issues being addressed through school, and the range of issues that health education and programs that can be there. And just wanted to give an example finally in the next slide of some kinds of different school programs which might serve as a platform for integration of further activities to address diabetes as well. You know, even though it's mental health and bullying prevention in Indonesia, or Jamaica Moves, which is focused on exercise and nutrition in Jamaica. In South Africa, we had a Good Nutrition for Good Immunity School campaign. In China, promoting mental health in classrooms. And again, just highlighting that managing chronic illness, disability, also is related with mental health. And so these are all important platforms perhaps to consider where we can build upon and strengthen for addressing diabetes in schools. So really appreciate the other panelists' insights as well, and look forward to the discussion. Thank you.
Thank you, Joanna, for your contribution. Before passing the floor to Ms. Fatima, I would like to remind all the people that are attending to leave your questions on the Q&A box or the chat box. We are collecting your questions to be answered during the Q&A period. So it's my great pleasure to give the floor to Ms. Fatima Al-Zuruni.
Hello, everyone. Thank you for having me today, and I'm very grateful for IDF for this special platform that will really help us all to share our experiences. I do appreciate also Dr. Joanne and Mr. Leo's emphasis on the support and on the importance of a school supportive environment and other interventions to enhance adolescents and young people's health. With that regard, one of the effective interventions that we have implemented in UAE is the KiDS project. As many of you are aware, KiDS project is primarily introduced to support children with type 1 diabetes to manage their disease and avoid their discrimination in school setting, and raise awareness on the benefits of healthy lifestyles among school children and even their families and their peers. The IDF and Sanofi has co-created the KiDS project and introduced the Arabic versions, and they worked with Ministry of Health and Prevention and Ministry of Education to review the materials and to carry out the implementation plan. The KiDS project also was very supportive in helping the UAE's national agenda indicator related to childhood obesity. And primarily the target audiences are the teacher, the school nurses, other staff, and children aged 16 to 14 years old And some of you might think why we have focused on this age group. It's because we have seen that childhood obesity is higher, specifically higher in this age segment. KiDS project was carried out in terms of two main methods. One is the fieldwork school education, and the second is the community event activations in public places. Next, please. As for the achievements for the academic year 2016 and 17, we were able to develop 3 awareness booklets for children, parents, and teachers in both Arabic and English languages. And of course, we have revised some of the elements to suit the UE community. In the beginning, we have targeted, we were able to train the 22 school nurses, and approximately 160 sessions were organized to educate more than 4,600 children, including 54 students with diabetes. And apart from that, we were able to educate 500 teachers and 800 parents. And some of you might see the numbers are very less. Yes, because in that planning phase, we took a lot of time in developing and in coordinating between the school and aligning a system to work on that. Next, please. As for the achievements in the academic year 2018 and 19, here we had a shift in our program implementation. Approximately 449 sessions were organized to educate more than 16,800 children, including 206 students with diabetes. If we are converting the percentage, it was around 34% of the total UE student population in the government schools. And just to comment on that, we have started with the government schools since it was a bit easier to introduce and to have that pilot program going on. And from that, then we carry on the private and other sectors. More than 1,300 teachers and 140 parents were educated. As for the evaluation plan, the plan was reviewed by end of the 2019, and we had great planning for impact evaluation, and we had pre and post evaluation set up to be implemented in the field starting from the 2020. However, with the COVID pandemic and all the restrictions, it was put on hold. And we are now, since our schools are getting back now to the normal occupancy of the students, we are going to work with our partners to carry out the evaluation to better understand the impact of the program. Next, please. As for the observation, educational sessions help the students to realize the misconceptions related to diabetes. It was not until we hit to the, in the school field, and when we communicated with the students, with the teachers, and the academic, employees there, we realized that there are many misconceptions related to diabetes in terms of diabetes might be, contagious, in terms of other things related to the severity of diabetes and so on. Second point is that the children with diabetes felt safer to address the issue with the school nurses, parents. It provided them actually a supportive environment, a network that helped them to communicate easily. Having a supportive team helped children with diabetes to get a better response from their teachers, and in terms of taking permission for insulin shot, using toilet more frequently as compared to their peers. Even joining PA classes was a bit safer experience for them. The experience overall nurtured a positive environment. We have included a lesson about diabetes. to inform you that we have a school health guide that is covering different lesson plans about different health issues. So we made sure to include one of the lessons related to diabetic, and which is very introductory lesson, not very detailed, to make sure that they have awareness in the school for different populations segment of the students. Next, please. As for the future work, expanding the KiDS program to cover other targets like children with special needs centers and nurseries could be more studied, and we can work together to cover or include them as well. Since the pandemic has given us the opportunity of virtual education, we can use this option for collective parent and child education, and even have parent supportive group and awareness group. The third point is very important because we have realized in the field focus study and the survey of the parent, we have come out with different findings. Parent education needs more emphasis, which is equally important when it comes to diabetes prevention and management. Mohab focus group study showed that parents' perceptions can negatively influence child behavior. I do agree with my fellow colleagues that a supportive environment is very important to nurture their behaviors, to educate them. And so even equally, it's important to have parents who are much more aware of the issue to handle that effectively. So some of the, some of the findings showed that screen time became a norm in child's life and even in adults, especially with pandemic. As you are very much aware, the online learning and the online working, the meetings all has created that normal routine. In some cultures, a chubby child who's overweight considered a healthy child. Specifically, like 74% of the parents have indicated that overweight child means it's a good sign. Parents are role models to their children, so inactive parents lead to inactive children, which may influence healthy food consumption habits as well. Overall, from the KiDS project, we believe that we should, and as Mohab strategy, we work on different multi-sectoral approach to tackle the issue, because healthy lifestyle is a big issue and need to be addressed from different angles, from micro interventions to macro level policies. That's why we do love to incorporate these specific target related projects like KiDS project to cover the segments which are really in need to be addressed. So thank you everyone for listening, and we'll be happy to answer your questions at the end.
Thank you, Fatima, for your contribution. It's really nice to see the KiDS impact on your country. So I would like now to ask Professor Karim to take the floor and to give his presentation. Karim, please go ahead.
Thank you very much, Joao. It's my pleasure to participate in this meeting, and a warm good morning, good evening to all of you. I'm Karim de Beaufort and current president of the International Society for Pediatric, Adolescent and Young Adult Diabetes. This is a unique global society with a focus on all forms of diabetes around the globe, and we were very happy to participate in the development of the KiDS program, being very important to be implemented in different regions, and I would say even worldwide. Next slide, please. I think this is something everybody knows about, and still there is a lot to do in order to get it really implemented. Even if it's signed by 192 countries, I think there are still a lot of places around the globe where there is not access to education or to the health people should get. And this applies more specifically, next slide, of course, to some of the non-communicable diseases, where we've got quite a lot of issues or important factors which have to be considered if you want these young people to become healthy adults with a long future. And here a little bit more specific on type 1 diabetes, metabolic control outcome, this prevention of acute the hypoglycemia and the DKA, diabetes ketoacidosis, which you want to prevent in order to prevent as well the chronic complications. And on top of it, you want a kid to be a kid. And if he is an adolescent, he needs to be exposed to the behavior of his co-adolescents. And at that time, parents are going to be a lot less important than their peer group. Of course, the prerequisites will be that there is access to insulin strips and education, diabetes-specific education, and of course, general education. If you look at type 2, we need to become far more active, and that has been already addressed by my previous colleagues in this webinar. We need to see how we can improve healthy habits and facilitate and stimulate it, and that includes the food choices and physical activity. And I think we all have been confronted with the worries around the impact of the pandemic on these. Next slide, please. Now, of course, as doctors, we think that we're doing a lot in the care of children and providing a lot of support to families with children with diabetes or adolescents with diabetes. But let's be realistic, that might be 10 hours per year of those more than 8,000 hours. But of those 8,760 hours, more than 1,100 in some countries, these children are at school. So we need to ensure that we support this positive environment for self-management, for a healthy lifestyle in that environment. Next slide, please. And it's very frustrating, even in 2021, that we still have not achieved our objectives. There still are children not allowed to go on school trips. If you talk about type 1 diabetes, there is needle phobia in teachers, or there is just too much trouble, too much fuss, anxiety. There's a lot of worry, and the children are not accepted. The peer group, who sometimes can make stupid remarks like you're a druggie and it's your fault, and oh my God, is it an infectious disease? There is such a lot of education still needed in order to create this environment where they are seen as they are, as persons, yes, who have an extra job to do, but who can participate in anything. And I have to mention, if you go to the right block, the refusal to initiate a pump treatment in a young child with diabetes in Australia. And you can find the report, I think on YouTube, where the mother said, we wanted to have the best treatment for our kid, and we were able in our country to get pump treatment, but it was an argument that she wouldn't be accepted in school, because in school they wouldn't accept a pump treatment. So the treatment decision of a child with diabetes was finally taken by the fact that there was not enough education provided to the school. If I look at my country, small, I know, I think the experience with these kind of treatments is very often that it's simpler, but it's education, education, education. And if you look at discrimination, exclusion, bullying, the list of things I've mentioned on the left, in the left block, they are not rare, and they will have a massive impact on the quality of life of the child, the quality of his metabolic or her metabolic control, and as well as school performance. So we really need all to work together in order to improve this. And this is where education with a program like the KiDS program can play a major role. Next slide, please. And there you will see what we all have to work at, to have that supportive approach where it should be collaboration between parents, young persons, the healthcare team, and the school. And we need to make sure that it's safe, that it's healthy, that all the aspects of diabetes care, be it diabetes type 1, be it diabetes type 2, be it prevention of obesity, we all need to work together in order to move this forward. And that includes the training of school personnel, which in many regions, it can be through the kids program together with the healthcare team, with ministries. It needs to be done. And I think in the end, the most important is that it's offered and installed and implemented. And then we will win at all levels, everyone. The information should be not only provided to school personnel, but I think we also need to consider the fact that the friends and the colleagues need to be informed and not afraid or excluding. If you look at type 1 diabetes, we cannot say that the school is going to be decisive of the treatment the child would get. It needs to be the best for the child and the family, which will be depending on the region of the world where a certain person is living. And that there will be some of the questions, I think, popping up later on, that when you live in Africa, or where you live in Nepal, or whether you live in a big city in the US, it might be different. It's all what we have to think about is the outcome and how it works best for that family and that child. And we need to ensure normal glycemia, because we know that if the blood sugar values are very variable, and I think there are a lot of people around who can define that much better than I can, it has an impact on your concentration, it has an impact on your feelings. So we need to work on all these aspects to improve the well-being of the persons with diabetes, make them feel positive and without any kind of stigma or impact on self-esteem. Next slide, please. And only if we manage all together, by working together in a program with like the kids program, but really get it implemented, then we can start preventing prejudices, work on the education and information, and create that healthy environment which is needed, whether you have type 1, type 2, or whether you have obesity or a risk for obesity. Here you see what needs to be done, working together. I thank you for your attention, and I hope to have a lot of discussion afterwards.
Thank you, Corinne. We definitely need to have a secure and healthy environment for kids in schools. For me, it's really great to see so many people attending this webinar from such different countries, from Australia to India, Malaysia, Kenya, Portugal, you name it. Thank you for attending. We are going now to start the Q&A session. We will try to answer the maximum question that we is possible on this time slot. We are a little bit behind time, but that's fine. We'd like to ask all speakers to put your camera on. So there was a few questions already. Someone asked, how can we collaborate with IDF to start kids program in India? So anyone that wants to start the kids program in their respective countries is invited to download the materials that I will be speaking in a minute, and to learn how to do it. And you can reach out IDF for support. You can send us an email to kids@idf.org, and we will share this email again at the end of the webinar. So I have a question for you, Fatima. The question is, how can kids help school students in preventing the development of type 2 diabetes in the future? Is the kids program associated to the school feeding program? Can you elaborate a bit more, Fatima? Fatima, please, you are unmuted. Can you?
Thank you.
Okay.
The question can be divided into two parts. First of all, how kids can prevent type 2 diabetes. In this regards, because kids is not only concerned with the diabetic students, it was also about teaching children about the healthy diet plan or healthy eating habits, and what are the good options and what are the unhealthy options. In that regard, along with other interventions that is being designed for schools. For example, we have healthy portion, awareness session, and we have also school healthy lunchbox program, So all that can help in educating children about the healthy eating habits and the importance of having healthy eating in terms of their development, their academic enhancement, and in terms of shaping their healthy future. So all that can greatly impact in reducing the type 2 diabetes in the future once we have these educated children who are following the healthy eating pattern. And as for the second part of the question, is it a part of the school feeding program? I'm not aware about other countries because it could be a feeding program could be a strong part where I think governments take in charge to provide the meals to the schools. However, in UAE, we have a school canteen guideline where we have specifically assigned different meals and recipes and even the options for healthy drinks and snacks and so on. So that is very detailed guideline, and because it's comprehensive and because we have variety of schools, we have like private, government, we have long hour schools, and we have like part-time schools. So depending on that, we have municipalities carrying out this guideline, and they are following it with school administration and the canteens who are well studied. Like, for example, the food suppliers who are providing the meals to the school should be approved by the municipalities. They should provide the right ingredients and the right food options. So I hope that served the questions.
Yeah, thank you, Fatima. Yeah, indeed, the school canteens are sometimes a problem. Countries like yours that have strict guidelines to the canteens are doing a great job, but in many countries such guidelines do not exist, and the school canteens are really a problem because they are not promoting healthy lifestyles. So Corinne, a question to you. How can a child from a family from a low resource setting manage their blood glucose? What KiDS program can do help in this situation? Also, how can we increase compliance to medication in poor families? So how can KiDS help out in all this respect and trying to help out kids with diabetes to improve their control?
Thank you very much, the person who asked this question, a very important question. And I think wherever one is in the world, there are three essential pillars which are needed for every child who has diabetes, type 1 diabetes, needing insulin. First of all, you need to have insulin. Second, you need to have strips or possibility to control the effect of the treatment given. But those two alone won't be sufficient if you haven't got education. And of course, if you haven't got education, it's very difficult to move forward. Once there is a good education of the family, which can be, and there are different materials available, because it needs to be either visual or with specific language. And once you've got that with family, then with a KiDS program, you can train the personnel in the schools. I think everything which is unknown and extra will be difficult to implement, and to create a safe environment with self-management. It's essential to have the basics, which is education, insulin, and strips. And there in the education, as mentioned, you need to include the wider environment. And then I think many things are possible. And of course it is a challenge, because in less resourced countries, another factor comes, and that is food insecurity. Don't know always beforehand whether there will be the lunch you expect there to be. So you have to include that as another factor as well. But I think education, and insulin and material to control, and then teamwork. Teamwork family, teamwork healthcare providers, teamwork school, because those kids are 1,100 hours a year at school. So, and I think here in the KiDS program, there is a lot of information which can be used, and the rest needs to be tailored to the local situation.
Indeed, thank you, Karin. Indeed, because sometimes when there are several kinds of discrimination, as you know, but some of them in schools are coming from the fact that they don't know what is diabetes. They are not aware of what's diabetes, what are the needs of the kids with diabetes. So all the education that we can provide to the kids, families, and the school environment is highly beneficial. So Leo, a question to you. What could be the place of a program like KiDS within the Global Diabetes Compact? Interesting question.
Yes, thank you very much. I think this is really important. KiDS and other NGOs or civil society organizations, they can really play an important role, especially in the awareness and education component of the package, which is the global diabetes impact, so they can help create awareness about the issues, especially for children living with diabetes, and avoid stigma. But they can also help with implementing the different components or promoting the different components of the health promoting schools concept to have health services for children living with diabetes, but also to have the educational component, and also thinking about prevention in the future with promoting healthy lifestyles and reducing the risk factors, and as well advocating for a healthier school environment where it's easier to practice physical activity and to eat healthy through the regulation of the sale and marketing of unhealthy foods. And as well, they can also play a role in advocating for policies at the national level. And we can then think about also about marketing restrictions, have a regulation on the school food, and taxing sugary drinks, and have a good information system, front of pack labeling that warns about the risks of products which are high in salt, sugars, and fats. So it's really important, the role that KiDS and other civil society organizations can play.
Thank you. Indeed, we need to work together to make a change, because the change will only happen if we work together as a community to promote healthy lifestyles and all the measures that we can think of. Some of the measures might work in a country, might not work in another country, so we need to think which measure can work in a specific country. Fatima, another question to you. So the question reads, who delivers health programs in schools? Who will provide diabetes procedures training to staff to support students who are not yet mature enough to do this themselves?
Okay. So we have like two departments. We have the Health Awareness Education Department, where I work in, and we have the other department, the School Health section, where it belongs. So we jointly worked on developing the complete kit in terms of health awareness education materials, plus the training of the school nurses, because we have realized that there is no use of communicating the kids' awareness and kids' education and all, and when the technical aspects are not covered in place. So when we are telling the school, telling the students that the school will be supportive, the academic staff will be helping you, and then the academic staff and the nurse are not helpful enough. So what we have done is that we have a school nurses trained, and we had like a 1 week program training, educating them about different aspects, plus how to, because different kids have different even needs in terms of the insulin shots and all. So we have tailored that program, and we have taught the school nurses, and we asked the school nurse to even teach the school class in charge of that kid in terms of if she is not available, so there's someone else covering that place. So that is how we have worked in terms of getting them ready to this program and efficiently handle the diabetic child who cannot manage or monitor themselves. Is there any other part of the question?
Thank you, Fatima. I don't think so. You need to close down the Q&A session, but Joanna, you did not have any specific questions to you. We would like to give a final, let's say, comment on this session.
Sorry, I think you said to me, or?
Yeah, there were yes. Not specific questions.
No, it's fine.
But so I would like to give you the floor for yes. 30 seconds to give a comment
sure.
Or something like that.
I would just really like to emphasize what everybody has said. You know, it's important to build the capacity of the child, but it's really interventions, thinking through what interventions are needed to support the caregiver in the home, and creating that collaboration between school and home, and also in those points that Leo also mentioned about food systems, creating the availability of nutritious foods, because a child, we've seen, they might have the knowledge, they might have even the motivation, but there are those factors around them that are beyond their control. So we really need to address interventions and investment at that level. The drivers for these unsafe, unhealthy environments are multifaceted, so the solutions must follow that way as well. Thank you.
Thank you, Joanna. So I'd like to thank again Leo, Joanna, Fatima, and Karin for sharing their expertise with us. Now it's time to talk a little bit more in detail about the KiDS program and its potential to create a supportive school environment for a healthy future generation. Next slide, please. I will try to save some minutes in my intervention. So we have started these webinars by saying that diabetes particularly strikes young people and children. IDF estimates that more than 1.1 million children, adolescents, and young adults under 20 years of age live with type 1 diabetes. Type 2 diabetes, we know that is becoming a huge global public health issue, and we know that due to the obesity problem, the type 2 diabetes in school will be a major problem in the future. Obesity, of course, and physical inactivity. We need to have a healthy and inclusive school environment that can help fighting diabetes-related stigma and promote habits to tackle the preventable risk factors of type 2 diabetes, as was pointed out several times during the discussion, as we heard. Can you please move to the next slide? So this is the reason why IDF developed the KiDS project in 2013 together with ISPAD, the International Society for Pediatric and Adolescent Diabetes. The KiDS program has been supported since the creation through an educational grant from Sanofi, and it was first piloted in Brazil and India with the support of Associação de Diabetes Juvenil and Sociedade Brasileira de Diabetes in Brazil, right and the Public Health Foundation of India in India. And there are two possible implementation models. One is ad hoc sessions, which was done in over 45 countries, and also a structured implementation with the support from policymakers, local NGOs, and other partners. This has been done in 10 countries. You can see here the figures, and we do hope that this number will increase in the future. We hope that in the coming years, the KiDS program will be implemented throughout the globe, and it has a greater impact than it has now. Next, please. The KiDS website has several materials that can be freely downloaded. Please go to the website and download the materials. The website is www.kids.idf.org. The materials are there for you to use. Some of the materials are translated in 2 different languages, like the KiDS information package. So we have that information package. We have the advocacy toolkit, which is a relevant toolkit for those that would like to implement KiDS to do how to do it. and we have also the nutrition guideline and the nutrition quiz. It's very important for us that you share your experience with us when you implement KiDS. Now we would like for you to listen a short video from Sergio Jaramillo Vizcaíno, a 9 years old student with type 1 from Ecuador. We want to hear his experience in school and what he thinks about the KiDS program. I have to tell you, this video is absolutely amazing and powerful, with very, very strong message and given in a very delicate manner.
¿Cómo se llama usted?
Sergio Jaramillo Vizcaíno. Vivo en Ecuador, tengo 9 años.
¿Qué tipo de diabetes tiene Sergio?
Diabetes tipo 1.
¿Cuántos años tenías cuando fuiste diagnosticado?
A los 2 años.
¿Qué piensas tú de la diabetes, Sergio?
Que es algo bueno y sí, pero si lo tienes, igual serás un niño normal porque no importa.
En la escuela, ¿quiénes nomás conocen que tú tienes diabetes?
Mi profesora y mis amigos.
¿Cómo eran que ellas te cuidaban, Sergio? Cuéntame algo que te acuerdes.
Un horario para que sepa cuándo inyectarme cuando voy a comer o para ver cuánta glucosa tengo.
¿Y qué más tienen que hacer los niños que tienen diabetes?
Deberían intentar cuidarse.
Ya, ¿y qué más? ¿Deben practicar deportes?
Claro.
Ya, ¿y alimentación?
Claro.
¿Tuviste alguna mala experiencia por tener diabetes en la escuela? ¿Algo te pasó? ¿Alguna anécdota? ¿A ti te gustaría que haya un programa especial en todas las escuelas que se llama KiDS, que es un programa para dar a conocer a todos los niños que tienen diabetes, enseñarle a los maestros? ¿Tú crees que todas las escuelas deberían tener un programa así que ayude a los niños que tienen diabetes?
Claro que sí.
¿Tú crees que el presidente de la República, los alcaldes deberían saber de todos estos temas?
Claro.
¿Qué les dirías tú?
Que tienen que conocer a las personas que tengan diabetes porque hay algunos niños que son pobres y no tienen nada para cuidar su diabetes.
Ok, el cuidado es muy costoso, Sergio.
Gracias por escuchar este video. Si quieres, regálame un pulgar.
Thank you, Sergio, for sharing his testimonial, and to Joao and all the panelists for such an interesting discussion on this very important topic. I think we are carrying out a very interesting discussion, and I would like us to now share some more about the importance and challenges of bringing diabetes education to schools. We'll do this through our roundtable, and I am very happy to introduce this roundtable of 3 very powerful ladies, very impactful advocates for bringing diabetes education to schools. We have with us Sarah Bijendzika, who is an IDF Young Leader in Diabetes from Uganda. We have with us Anna Slowinska, who is the president of Polish Diabetes Association, and Aisling White, who is a primary school teacher and has been living with diabetes since the age of 1 year. She lives in Ireland, and Sarah is also living with type 1 diabetes. Hello, ladies. Are you ready?
Hello, yes.
So we'll start this roundtable discussion, and I hope this will be a very interactive, very inspiring session for our audience. Sarah and Aisling, I'll start with you, since both of you have been living with type 1 diabetes for quite long. How was your journey as a student living with diabetes? How was school for you? Can we start with you, Sarah?
I got diagnosed with type 1 diabetes in my second year in secondary school. That was senior 2. I was 14 years old at the time. I didn't know anything about diabetes. I had suffered signs and symptoms of type 1 for months, and no one around me could tell what was wrong, not even the school nurses, until eventually I was just found unconscious in my bed and taken to hospital. Came back after hospital with very little information, just the basics. This is how you inject, you shouldn't eat this, you shouldn't do that. And so I relied on that for the next almost 5 years in secondary school. I didn't have enough information. People at school were very ignorant about diabetes. The information was alarmingly low, especially with school staff and the nurses. So I just survived on my own with the little information I had, and it wasn't easy at all.
Aisling, this is like very concerning about all this not being recognized, symptoms being missed out, and all of the issues that Sarah has just shared. Did you face similar things living in Ireland?
Yeah, so like you said before, I was diagnosed when I was 1 year old. So I've had diabetes my entire way through my school life. I had it from the very beginning. The main memories that I have going through school, encountering issues with my diabetes, was a lack of education and understanding among the staff of the school, because they hadn't received training in how to assist children with diabetes when they were in school. So I remember it was quite difficult at points. I remember when I was 10 years old going into school with my injections and my blood tester and all of the things that I used to manage my condition, and standing in front of all of the teachers and showing them how to use my equipment and what I had to do on a daily basis to try and train them ourselves. But we didn't have any of the wonderful resources like KiDS that just helped to open that communication with teachers. We were just doing it by ourselves and hoping that we were doing a good enough job. But the diabetes management plan in the KiDS pack, I think, would just be great to open that communication between staff, parents, and children, just to allow them to understand how to look after their diabetes in school and what they can do to help the children while they're in school.
So that's so true. Thank you so much, Aisling and Sarah, for telling us about your journey. What were the main challenges, if I may ask again? Have you faced any type of discrimination? Was it with the management part? Can you just reiterate a few of those?
Yeah, I suppose in school, again, it was coming from a lack of training among the teachers. So at points when I would be taking hypo treatments in class, I'd be asked to stop eating in class, and I would have to explain why I had to eat in class. Certain things about managing my diabetes. In terms of even my peers not knowing enough about diabetes, it made me very self-conscious about the condition. So when I went to secondary school and I was in my teenage years, rather than taking my injections in the classroom when I was having my lunch or before I was having my lunch, I would be going into a different room by myself so that other people wouldn't be wondering why I was taking an injection, what was happening. So I think, yeah, just all of the problems that I did encounter during my school years could have been helped a lot if my peers, the staff, were all trained about diabetes and how they could help.
Okay, so Sarah, about the discrimination that you talked about, and you're such a strong girl for facing all this and going up with that. Can you just let us know a little bit more about how you dealt with that discrimination? Sarah? do we have you with us?
Yes. Please repeat that. I couldn't hear that very well.
No problem. So you were talking a little bit about discrimination. Can you tell us more about what kind of discrimination, what kind of stigmas did you face while having diabetes at school?
Like Professor Karim mentioned earlier, most of the teachers they had phobia for needles, and not just teachers, even school peers. So in many situations, I could find myself trying to find a discreet place to inject myself, because I could get weird looks and weird comments like, why couldn't you excuse yourself? Why are you injecting yourself or checking your blood sugars? That's very insensitive of you, you know, and that in the long run pushed me to deliberately start just because I didn't want to feel places where I couldn't find a discreet place to inject myself. I would just give up with injections, you know, and then of course I would suffer very, very bad sugars. But most of this was down to ignorance, you know, and lack of empathy, which still resulted from not having enough knowledge about diabetes and why I had to inject myself. So yeah, it was very uncomfortable, and in cases where I couldn't comfortably carry out self-management.
Anna, welcome back to the roundtable. And Sarah and Aisling have just told us about the kind of issues that they faced in their schools. My question to you, being the president of the Polish Diabetes Association and having done a lot of work on bringing kids program to schools and bringing diabetes education to schools. Can you just elaborate on how the kids program be helpful in creating a supportive environment for students with diabetes so that Sarah and Aisling and kids like her, do not face the kind of situations that they have faced in their lives?
So first of all, I apologize for my technical problems, but you know how it is with technology. It always breaks down at the most horrible moment. And so, yes, programs like the kids program is very much needed at school, like in Poland, but I assume everywhere else, because it basically raises awareness about diabetes, about the types of diabetes, because a lot of people very much confuse type 1 and type 2 diabetes. So the program both helps children with type 1 diabetes not to be discriminated against at schools. It helps teachers to understand diabetes and also how to help and how to take care of a child with type 1 diabetes. But also the program helps to prevent type 2 diabetes because it raises awareness on healthy lifestyle, on healthy lifestyle choices as well. So I think the program has a lot of benefits and is very much needed. And in some schools, if it was not for the kids program, it would be very difficult for children who are there with type 1 diabetes, also for their parents, and also for the teachers who sometimes are actually afraid of taking care of a child with diabetes. If you can believe it, we know a case of a teacher, a female teacher, who actually changed her place of work and moved to a different school because she did not want to teach a child with diabetes. She was so afraid. So kids program and other programs also carried out by other associations and non-governmental organizations that work in the field of diabetes really help all of those children at schools.
Oh, wow, that's very difficult to digest, but I think it's just because of a lot of myths that that circulate in underdeveloped countries specifically regarding diabetes, specifically that it is contagious, that that instigates such behaviors. And it is so important. When you were talking about this, I was thinking that when we think about type 1 diabetes, while insulin is the only treatment, healthy lifestyle is so much important, which not only helps with management of type 1 diabetes, but also prevention of type 2. So that is that's the importance of KiDS program. But let me dig this a little bit deeper. What is the importance of diabetes associations like the Polish Diabetes Association in bringing diabetes education and healthy habits to schools?
So as I said, it's very important because I don't think there is enough of all of those issues and all of this information at schools. And sometimes if it was not the associations, then there would be no one spreading the awareness of diabetes and also trying to stop discrimination against the children with type 1 diabetes. And also maybe against discrimination against obese children, because obese children who are at risk of type 2 diabetes, they also suffer, they are not happy. So it's a great way for the associations to show that there are ways to live a healthy lifestyle that may prevent type 2 diabetes, and also to teach everyone how to not discriminate against children with type 1 diabetes.
Yes, exactly. And also for parents to take type 2 diabetes more seriously, because we as humans in the world have been ignoring type 2 diabetes prevention for long, and there is no better way to start than in schools. So Aisling, can I again ask you the same question that I asked Anna a little bit back? How do you, as a primary school teacher, see the KiDS program help on creating a supportive environment for students with diabetes?
Yeah, the KiDS program is so well laid out to open that communication between all of the groups that are involved for caring for the child, or just educating children about diabetes and the different types of diabetes. So when you go into the document, there's a section for the parent of the child with diabetes, the parents of children who don't have diabetes, the staff in the school. It's all laid out in different sections so that you can go to the relevant section and learn for yourself. Like I say, there's so many documents there for a school that would have a child with diabetes attending their school. So for example, you can take the diabetes management plan, which takes you step by step as to how you can help that child in school, when they need to take their medication, what to do if their blood sugar levels are high, what to do if their blood sugar levels are low, what to do during exercise. It's great just to have that document written in school and a copy at home so that both parties know what they're supposed to be doing and what the responsibilities are. The document also outlines an entire list of responsibilities for each party, so for the parents, for the school, and for the child. And that really just helps to let people know, like somebody was saying earlier, that they were afraid that teachers didn't want to teach children with diabetes. But with that list of responsibilities that outline the role of the student, the role of the parents, and the role of the staff, it takes a lot of pressure off as a teacher, knowing that you know what your responsibilities are, and if something comes up that's outside of that realm, you can refer back to the diabetes management plan, or you can call the parents. There's also so much educational content with the PowerPoints. I could really go on all day about all the content of the program and how it will help in schools, but really those two parts of the document, I think, are a great starting point to open communication between the school and the family, and to understand how we can help the children.
A little bit of a personal question, Aisling. Did you ever receive training as a teacher or coaching regarding children with diabetes in school before this KiDS program?
So no, as a teacher coming through my teacher education, I never received any education about children with diabetes. when you qualify as a teacher, there's an option to do continuing professional development courses. So they're 45-minute courses in the evening. I've seen one education centre in the country offering that course, which just raises awareness of the differences between type 1 and 2, but it doesn't support the schools in assisting those children while they're on the school grounds or in creating that diabetes management plan to help them to assist the children on the school grounds. So it's not addressed enough in teacher education, but I think with the kids program and with diabetes associations helping us to inform schools about the program, then we should be able to improve standards for children with diabetes.
Fingers crossed. Looks like encouraging thing to do, and I think we should learn more from Anna, because the Polish Diabetes Association has been successful with the kids program. Anna, can you recount some of the successes of your association with the kids program in Poland?
So the program was first implemented in 2017 in southern East Poland. We chose that region because there was data saying that the highest percentage of obese children live there for some reason. So back then in 2017, we really gained a lot of partners, like the local decision makers, the local council, the city mayor, the local university, a lot of influential people and institutions who were very enthusiastic about the program. And back then it was a huge success. So let me give you some numbers. Back then we were present in 15 schools. We trained 40 teachers and 1,373 children. So back then we thought it was a huge success. So 1 year later, or nearly 2 years later, we did another edition also in Eastern Poland, but this time in the Northeast. So then we were present in 46 schools. We trained 120 teachers and 2,000 children. So we also thought it was a huge success. And in 2020, we wanted to do yet another edition of the kids program in North Poland, in the Pomeranian district. But then we had the COVID epidemic. So at first we tried to postpone the training, but then, because the situation with COVID was bad for such a long time, then we decided that we finally had to do the online edition. And that, even though at the beginning we were not very happy about it, but then it turned out it was a huge success because a lot of people could take part in this because it was online. So actually we were present in 104 schools. We trained 650 teachers and 39,378 children. So it really did increase the reach of the project by like 20 times. So with the online edition, we also did a special film, an educational film, which is both for the teachers, for the parents, but also for children. And we also did a quiz, an interactive quiz to make this edition even more interesting for everyone. So I think we were very successful with that.
Wow, that's the power of technology, and COVID and this pandemic has taught us a lot about the use of technology, which is a game changer in today's world. So I'll now direct my question to all three of you. Let's discuss the barriers when it comes to bringing diabetes education into schools. What are the challenges, the main challenges that you ladies as diabetes advocates may have faced in bringing diabetes education to schools? Can you start with you, Sarah? Sarah?
Sorry about that. Before the pandemic, before COVID happened, I volunteer with a patient organization called Africa Diabetes Alliance, and together we are being supported by our member association, Uganda Diabetes Association, and we were meant to start a diabetes education project in schools using the KiDS program, of course. And one of the main challenges were because schools were very busy at the time, and shortly after that, they were all closed, so we couldn't carry out the project like we wanted, unfortunately. But so most of the schools weren't as responsive as we thought they would be. They didn't welcome the idea with enough excitement like we hoped, and we were disappointed with that. But hopefully, once everything goes back in order, we can be able to successfully implement the program and get some benefits.
Great, thank you, Sarah. Ashlyn, can you tell us more about the challenges that you might have faced in bringing diabetes education to schools?
Yeah, I think the main barrier that we constantly come up with when trying to implement any new program in a school is that school teachers already have quite a full timetable with so many programs to implement, so many aspects that we're trying to cover, like well-being, healthy eating, and exercise is obviously taking a key role at the moment, which is great. So for example, in our schools, we have the Food Dudes program, which is focusing on healthy eating, getting children to try fruits and vegetables. We also have a lot of physical activity programs. So it is good to see those programs being implemented in schools. And I just think that the KiDS program can be implemented through the SPHE or CSPE, so the social subjects and health promoting subjects, just to give a few classes even to educate children about the types of diabetes, about how we can live a healthy life, even using the plate model from the KiDS program, so the Eating Well plate. It's a really good visual for the children to see how their plate should look before they're eating their meal. But yes, I think it's just trying to prove to the schools the value of implementing the program, the benefit that we will see in the future when the program is implemented, and the need for this to be included in what is already a very packed timetable. So if we can prove the value of the program, I think we can get it implemented in the schools.
So as much as I would love to talk more about this, the time for our roundtable is almost up, and I would want to now shift to the questions that we have received in the chat and the Q&A from the participants. Anna, this question is for you. How can we increase the role of school nurses in taking care of children with diabetes, especially those using insulin pumps?
It would be great if we actually had school nurses, because of course it varies in different countries, but in Poland we really have a huge problem with the presence of or absence of school nurses, because they are not present the whole time when the children are present. And this is also the reason why we actually have to train teachers how to take care of children with type 1 diabetes. When I said before, told you about the teacher who changed her job because she was afraid of a child with diabetes, I did not mean that she thought that diabetes was contagious. I meant she was afraid to take care of the child, to help the child. She was afraid that the child may lose consciousness, may die or whatever. So it's crucial to actually make teachers aware how life with diabetes is, what it looks like. Because with school nurses, it would be great to make them more involved, but they have to be present in the first place, and it's not always the case.
Is there a way to, in relation to this question, and there are similar questions that have been asked on the chat, and this is going to be my second last question before we just end this. Anna, if you can just briefly say what can probably motivate the teachers to take more care of children with diabetes in schools?
To show them that it's nothing very difficult, that they should not be afraid, because I think fear and the fact that they don't really know the issue, they don't know what diabetes is about. This is the major factor why they simply don't want to take care of those children. So I think, again, raising awareness, telling them about life with diabetes, and telling them specifically how they can help in given situations.
Thank you so much, ladies. Since we're running out of time, I'll have to end this Q&A session here. If your questions have not been answered, we'll try our best to answer, to get them answered through follow-up emails. Thank you so much for attending this session, and thanks once again for your insights to the panelists and speakers. Joel, can we have your closing remarks before we end this?
Yes, just to wrap up, thank you, Sana. So I'd like also to thank all the people that have attended the webinar. We hope that we have enjoyed and find this webinar useful. We hope that this webinar will trigger you to use KiDS in the future. We'd like also to thank all speakers for your interesting contributions. We need to thank also Sanofi for the support via an educational grant. And also I would like to thank the IDF advocacy team for organizing this webinar, Bea, Bruno, Carolina, and Clementine, and also Majo from the communication team at IDF for their support. So we would like finally to ask you to respond to the feedback questionnaire. This will be quite helpful for us for future events. And also, if you have any question, comment, suggestion, please drop us an email at kids@idf.org. We would like to wish you all a very nice day or night, depending on your location. Take care, and we hope to see you soon, very soon. We hope that the pandemic is over. We don't know when, but we really do need to see each other face to face, if not virtually in the next future. So take care and bye. Cheers.